Lots of questions about the cost of dental implants. So what affects the cost?
There's quite a few things. And it's a complex topic because, man, there's a lot of differences you can get. And so I want to go through and kind of talk about what you should be looking for when thinking about costs of dental implants and comparing office to office.
Okay.
What should I be considering? Because there's different things you can get. The first thing is the number of doctors involved and the number of locations involved. Okay. So what was very prominent and is still very prominent is the idea of using multiple doctors, multiple locations for each different step of the process.
Like what?
So someone comes in and they say, okay, you want new teeth? Well, you got to go see Dr. A to see if we can get grafting done. And they go through the process of having grafting done, and months later they see if the grafting healed, and they come back. And then they go to the next the original office again, and then they say, all right, let's go to the second office now third office to get dental implants. And so then they get dental implants and they let those heal for months and months and months. And then they come back to the office, and then the final step is to get the teeth. And so they go through an additional office to get the teeth done.
So it's usually 2 or 3 offices.
2 or 3 offices, and then another one to get the maintenance done. In our office, we place the implants and we create the smiles. So it's all happening in one area.
Okay.
I have a sheet, so I don't want to leave anything out.
Okay.
The next thing is the type of implant chosen. So
are there a lot of different implants?
There's thousands of different types of implants. There's only a few that are kind of the gold standard. We use the gold standard implant. We want these to work long term. And so choosing one that's using an implant specific to getting teeth on implants, a full set of teeth on implants, is really key. So that's one of the big things you want to look for as well.
Cost. Okay.
That affects the cost. The next thing is a lab bill. We're able to print and fabricate the teeth right there. And so when
how's it normally done?
Usually you're working with a lab that comes in, they do this whole process beforehand, they do a whole process during the surgery. It's really involved, and then they're taking it out for multiple weeks to get your teeth back. And so you're going through multiple sets of teeth that aren't really kind of connected to the implants at any point. Ours are connected to the implants the very same day.
So you brought it in-house?
We did.
So you have a printer that literally digitally prints the
Exactly.
teeth. Okay.
Yep.
What else affects the cost?
The next thing that affects the cost is the insurance coverage. Generally, insurance doesn't cover procedures like this, dental insurance as it is currently. But when we know that the payouts are only about $1,000 to $2,000, $2,000 maybe the maximum that I've seen. But we have a great team in our office that's able to maximize your insurance so you can get as much paid towards this treatment as possible.
Now, Medicare, like Medicaid, doesn't really cover this.
Typically not, unfortunately.
Okay, but they finance.
They will. So that's
do you have to have okay credit?
So that's the thing. If we can't get insurance coverage, we have options with financing this treatment over a period of time. Okay. And you have to have okay credit. A lot of people now are having a co-signer join on, somebody in their life that loves them and wants to have this be done for them, this process to have a new smile. They're co-signing on this to get it to where it's
How much is that?
Possible.
Approximately a month.
It's a few $100s a month is typically what people end up for the monthly cost for a treatment like this.
To get new teeth?
Yeah.
Okay, what else affects the cost?
So next in line is, boy, are we talking about the same thing? Snap-in dentures or fixed teeth. So
when you're Googling...
Yeah, when you go online, everyone's going to say new teeth, new implant teeth, new all-in-4, new denture, whatever the term is. But there's a big difference between what majority of people are doing and what we're doing. If you got to really know, are you getting snap-in teeth? Usually those are those lower cost options that are denture that don't really function like your natural teeth. What we're doing is we're giving people upper and lower teeth that don't come out on implants.
Okay.
Next is the materials for the final teeth. Like I said, some people are using denture material, denture teeth.
So there's ways to cut corners.
There are. And you know what? That used to be the only thing that was available. We only had materials that were plastic or plastic connected to some sort of metal piece, right? Right now, we're able to use top-of-the-line materials because they've been developed recently, such as zirconia and zirconia attached to titanium. That's really kind of the strongest thing we can put in the mouth.
Okay.
You can eat anything that you want with these teeth. We call it the bulletproof option because it's one that we expect to work really well long term. Next is the extent of surgery required. Some offices, it's hard to quote people over the phone because some offices are having patients go through multiple rounds of grafting, multiple times of implant placement, all at different points. Some people have their teeth removed in different appointments. We do all that extent of surgery all in one visit, typically not needing any grafting at all.
Okay.
The next thing on the list here is the extent of surgery required. Some people need different things. You might need your teeth taken out. You might be in a denture. You might have had a lot of bone loss that required just specific implants. And so really we want to meet you to know what your needs are when going through the process.
To give them a quick quote.
Exactly. I don't want to overquote you.
And you have a low price guarantee.
We do. We want this to be something that, we feel very confident in that this process is one that works well. And
By
it's
the way,
most efficient.
as of today's date, according to ChatGPT, you are the low price leader.
We are.
Where you are.
We're typically 15% below the national average for doing this process because of the team, because of the process, because of the technology. And so it's hard to recommend any other way because we really feel like that's the best way to get this done.
And finally, experience. How does that play a role in the overall cost? The
That might-
experience of the dentist doing this.
That might be one of the bigger things because in all reality, you want to get this done once. If you can get it done once and have it work for you, compared to if you go to someone that doesn't have the experience of doing this, they might recommend for grafting as a big proponent of, or a big component of the surgery. I know a doctor who told me that they had a patient that had $10,000 worth of grafting done. They even haven't had a single implant, and they're 6 months
All
into the
because
process.
of lack of experience?
It typically is. We're finding that grafting is not necessary on the majority of cases. So when we think of getting this done once, that's going to be the most cost-effective way to do this. Additionally, if you have to go to multiple different surgeons, multiple different prosthodontists,
And the
dentists,
only reason they're using these
offices,
other doctors to get this done is just because they don't have that training. Is that correct?
They might not have the training, they might not have the technology to do it in-house. And so, if you have to go through multiple different people to
You've
get the same
traveled all
thing.
over the country and out of the country learning this?
Yes. Yep. I mean, we've
South America even?
gone to South America.
people with
gone
limited bone, you said?
all over the country to learn about people with limited bone, people that are dealing with dentures, people who are dealing with broken teeth that are looking at dentures, with the goal being that we can get them new teeth on implants that are fixed, they don't come out.